Hello and welcome to Side View. In this session, we are exploring understanding anxiety. Anxiety is common in all phases of life and it affects a lot of people. Anxiety can cause a lot of stress, fear, and other related problems. So, what is anxiety? Anxiety is a normal emotion which helps us recognize real problems and solve them. In its healthy form, anxiety helps you to perform at your top form when you're adjusting to, for example, a new job or a new baby. Anxiety is not normal when it lasts for days or when it lasts beyond a specific stressful event or when it interferes with a person's life. So let's look at the anatomy of anxiety. What triggers it? So when the senses pick up a threat that is scary, creepy, it puts the brain on alert. The amygdala, a part of the brain, triggers a series of changes in the brain chemicals and hormones that put the entire body in anxiety mode. So during this time, a lot of things happen to your body. The brain tells the adrenal glands to release stress hormones. The adrenal glands release stress hormones into the bloodstream. Stress hormones stimulate the sympathetic nervous system into action. The sympathetic nervous system remains stimulated until the stress hormones are used up. Once the stress hormones are used up, the sympathetic nervous system gears down. So a typical example would be being face to face with a lion. So what happens is your brain sends the signal to your body, and the parts of the body that are not needed at that point will shut down. For example, the digestive system is not needed at that point. It shuts down, and the energy from those parts that are shut down will distribute to the relevant parts that are needed. For example, the eyes become sharper and bigger, the hands and the legs become firmer, and it prepares you for a fight or flight. So now let's look at types of anxiety. According to the DSM, I think the current DSM is version 5. There are different types of anxiety. First is panic disorder, specific phobia, obsessive compulsive disorder, post-traumatic stress disorder, generalized anxiety disorder. Other forms of anxiety include acute stress disorder, anxiety disorder due to a general medical condition, substance-induced anxiety disorder, and other forms of anxiety such as separation anxiety. Symptoms of anxiety disorders. There are 3 main categories of symptoms. Motor tension, which involves trembling, feeling shaky, muscle tension, muscle aches, restlessness. And the second is automatic nervous system hyperactivity, which includes shortness of breath, feeling of being smothered, heart rate increase, sweating or feeling cold, clammy hands, dry mouth, and dizziness. And the third is hypervigilance, which includes feeling edgy, difficulty concentrating, and irritability. Anxiety problems can lead to other problems. For example, social phobia has been shown to be associated with alcohol and drug abuse, dropping out from school, unemployment, and loneliness. There are a variety of anxiety-related disorders. One of them is hypochondriasis, which involves the fear of having a serious disease despite having no symptom. In this situation, the sufferer becomes hypervigilant and preoccupied with the perception, the thoughts of having a disorder. There are different treatments for anxiety disorders. We have cognitive behavioral therapy, relaxation training, behavioral approaches such as desensitization, and pharmacotherapies such as the use of medications. So if you think your anxiety has gone beyond normal, please do contact a registered professional. Please let us know your thoughts in the comment section. And do not forget to like and subscribe.